This is Dr. Jerry Hesch, physical therapist at Hesch Institute in Aurora, Colorado. And my client is a professional dancer, okay? And I've been treating her body, several parts of the body. I treated the right, if memory serves me correct, the fibular head was posterior. Am I correct? So I pulled that forward and your ankle felt much better in response to that. So that was interesting. Today she cued me into some pain in this area, and she pointed between the first and the second toe there. And I'm going to take your socks off, okay? So I just jump into my thing. Oh, that's probably a neuroma, and a neuroma is this. And I thought, Jerry, go test it, okay? And so I came and I said, well, you know, your mobility is good, you know, and I said that before testing it, which, you know, one shouldn't do that, but I did it. I'm a bad boy. But she has good mobility of the distal part of the first metatarsal. And if I come and I capture the proximal part, she has good up and down mobility. By design, there will be less mobility at the base of the metatarsal than at the top up here. All right. Now I'm seeing a little bit of drift, just a little beginning of a hallux valgus. So those off-the-shelf toe spacers that you can buy anywhere, any pharmacy, any Walmart, blah, blah. You know, the dollar stores might have them, I don't know, but they're about $5, and they just go here and they just give your toe a little more laterality. Getting a little bit of bunion there, so maybe that'll help, you know, add to the longevity of this overworked foot, okay? So there's that. You can buy some that actually spread all the toes. I don't know if there's an advantage for you or not. You might really like that. I mean, how does it feel when I spread all your toes?
Super nice.
Yeah, as a dancer,
yeah.
I think you're going to like the one that spreads all your toes. So
right.
that's something you can do in the evening when you get home. Just pop them in there and, you know, and something like that you can wear briefly and get a lot of benefit. You don't have to wear it all night. You don't have to wear it 24 hours a day and all that nonsense. You know, a little bit of reduction of stress can be very good.
Nice.
But the reason I'm filming this is I wanted to show something. I also evaluated mobility of the phalanx in relationship to the metatarsal. I came over here and I said, oopsie, it looks like a drop metatarsal. And you can read up on that. You can go to PubMed and look up articles on that. And it's based not on how things look, but that was my first clue. It looked lower on the second metatarsal head. It's based on, okay, I'm going to stabilize the first one, and then I'm going to test upward movement. There's no upward movement. It's based on a lack of mobility. Okay? I do not look at posture and say, oh, that's down, that's stuck up, whatever. No, it has to be a mobility evaluation. Now I'm going to stabilize the second metatarsal, and the third one has good up and down mobility. Okay? Now, if this metatarsal head is dropped, it doesn't just drop here at this joint. Down here, it has to come up. Okay, so I'm going to follow that second metatarsal, and I'm going to stay well ahead of the cuneiforms, which are probably right here. We could debate that till the cows come home. I'm not going to. But you know what? The base of that second metatarsal doesn't have an ability to drop downward. Okay, now I get to push it up. Oh, it's happy to go up. So the treatment for this is going to be for me to traction the metatarsal to kind of open up mobility. It's called gapping the joint. Okay, so I'm pulling the second metatarsal towards me, and then at the base I'm going to work on bringing it downward. Okay, so I'm actually pushing it downwards towards the bottom of the foot. Okay, and I'm going to bounce it downward. And it looks like I'm doing nothing, but I really am doing little tiny micro bounces. You feel that?
I can feel it.
Okay, so I'm going to do about 30. That felt like 10. Okay, and then I'm going to just relax, and I'm going to tighten things up, and guess what? We now have downward mobility. Okay, so I am obligated to test all of her metatarsals, and I'm going to do that on both feet. Okay, but I don't think the others are misbehaving, at least not on this foot. A really rare injury is a ski boot or skating shoe injury that compresses this fifth metatarsal. It's right here. There's a step off there. And so I test that by dragging it forward. And if there's any problem with up or down motion of it, it is the fact that it's compressed backward. And when you restore it being forward, that up and down mobility is restored. But this foot seems quite happy. Her midfoot has good pronation, and I can even drop the navicular downward. And rear foot has excellent mobility. Dorsiflexion is pretty good. Actually, that might be a little tight. You know what? We're going to work on that too. Okay. See, I'm trying to spring it, and that is a hard infill. And it's only 5 degrees of dorsiflexion, and you are a young, tall, athletic, 26-year-old. And I'm a charmer. Yeah. Okay. So we would expect her to have about 15 degrees of dorsiflexion. Okay. And I'm only seeing 5 degrees. So let me back it up a little bit. This is a wonderful flexible foot, and I don't even know if these can be bought anymore on the internet. But this is a left foot. I don't have a right foot that has this elastic, that has mobility. So bear with me. So this is the first metatarsal of the right foot, and then this is the metatarsal of, the second metatarsal, and it connects to the first cuneiform bone. A little bit with second cuneiform. It connects to second cuneiform, a little bit of connection with the first cuneiform, a little bit of connection with the third as well. Okay? And so after I tested the mobility there, I came down behind it, and that cuneiform is good. Out here, that's good. I'm going to back up just in case my palpation is not accurate, and the keyboard cowboys will tell me there's studies that show two people can't agree, and I'm like, I don't care. If I can find the restriction in this person, if I can help this person on the table, I really don't care about that research.
I agree.
What's relevant is helping the person on the table. Okay, so now I'm going to come to the bottom of the metatarsal, and guess what? We have upward mobility. Okay, now what I did do is I found a metatarsal pad. I buy them from Power Step. Power Step makes the most wonderful orthotic for pronators. Power Step. Okay? And the metatarsal pads are inexpensive. And then I showed her how to cut out a little piece and experiment to find the exact sweet spot underneath this. And then she can put it under that metatarsal. Okay. Now maybe you won't need it, so maybe you should just wait and see how you do. Okay. And you can experiment with other material. Let me look and see if I have some scrap. I have some craft foam, so there's no need to buy that metatarsal pad. Okay? So we'll do that. But let me show you. I so love treating feet. I was so confused by feet and ankles. I mean, I remember my instructor in PT school, give me a little confidence, say, you have great hands when you're palpating the foot. And I'm like, oh, good. Then I got nervous, right? I don't know, I'm funny. I'm a middle child. What can I say? But honestly, the foot and ankle was confusing to me for the longest time. But I borrowed a human foot. Okay, it was one of those long-term borrowings from an organization that didn't value it, and it was collecting dust in a closet. And so I borrowed it, and from that foot, what I could do is block all motions, okay? All motions except one joint. How does that move? Okay? What if we add the cuboid now? Let's let the cuboid move with the metatarsal. How does that work? 2 cuboids, 3 cuboids, add the navicular, blah, blah, blah. I mean, I learned so much. So much having that. And yes, they give you a bag of bones when you go to PT school and you learn anatomy, but this is dynamic. It has elastic in it, and that one had wire, but it had enough mobility that I could add those movements. It was wonderful. But anyway, getting to your ankles, You're very tight on both sides.
Yep.
They dorsiflex rather equally. I would test your strength, but I'm sure you don't have muscle inhibition or you override it because I'm sure you're powerful. What I'm going to do is I'm going to scoop the heel downward. And I see people mobilizing the talus like this.
Mm-hmm.
That's a terrible way to do it.
Okay, I have
no, it
had
doesn't.
done this a
No,
lot. Okay.
it doesn't work. It gains 2 degrees of dorsiflexion. That's like this much. That's like nothing. And it's published studies, right? And if you use this technique where you scoop the heel downward and then up to the ceiling, so there's an arc, okay? The talus is only right here. Right there's tibia, talus, foot. So I slide down the foot to that stopping point, and I apologize, it's going to be a little bit tender because you don't have muscle overlying this.
Right.
So I'm making direct contact on bone. Okay, watch this. Scoop, push, tighten it up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Look how much more that comes up. Can you see that?
I can feel
Okay.
it.
Well, the good news is the first one is free. Okay? And then the second one I'm saving for a new pickup truck. Okay? So let's treat this one, all right? So we just come down there, scoop up, push down, tighten everything up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? And so now I'm going to dorsiflex this one again. And now you have 15 degrees. That's wonderful. And you know, that does tend, and now I can bounce it. There's a good bounce, good end feel. So when you have your ankle stuck in plantar flexion, it changes your balance. And you're a dancer, you need balance. It also makes you hyperextend in the upper cervical. That's driven by a reflex, the righting reflex. I could treat your upper cervical every day and say, oh, maybe a little better, and it would come back. This is the cause of your upper cervical extension. Anyway, can you take a walk and come back and tell us how you feel?
Okay.
So I'm keeping your face out of this. She said fantastic. So you're bending and testing it out.
Yes.
Talk to me. Tell me what it's about.
It's bouncy. It's okay. So the type of dance I do requires high heels. So I am all the time with dorsiflexion. So I'm all the time on toes. You know, I don't get to stretch, I guess, as much. But the flexion that you meaning. Plantar dorsiflexion is usually very restrictive, and I can't.
And you can tell there's more. And I'm making sure I don't
have
have your face in this. I'm showing your hands and below. So you feel more bounce in there, and that makes sense. That makes sense. When you pronate, you do dorsiflex. You go into dorsiflexion, and that's kind of more of a loosening position of the foot, where the foot kind of spreads out on the ground to get more stability. You know, ultimately. And then it gets maximal stability, then it gets rigid, and then you push off and your heel raises, then you go into supination. But you were functioning all the time in a little bit more supination and not able to fully go into pronation, and your timing was probably off. But, I mean, I can't do that objectively. This is not a gait lab. There's one in Albuquerque, but as a clinician, it's reasonable theory. You know.
That makes sense to me.
So anyway, I think we can stop filming here. I think that's going to last, and I think now when you do heel cord stretches, there's 2 kinds, and one is for the gastrocnemius group, okay? And so I'm going to try and demo this, okay? I'm going to show a stretching. So that's the one where you step back with the leg, where you can't get the heel quite on the ground, and you just very gently try to get the heel to a point where you feel a gentle stretch. People are way too aggressive with this. Okay. The gentler you are, the more your brain is going to realize that this is safe, it's okay, and it's going to let you do this. And you're going to get a much more effective lasting stretch. Okay? I tell people do it 5 minutes. All right?
Okay.
So I want you to do this 5 minutes every day for a week, and then after that, do it twice a week.
Okay.
Okay?
Great.
The second one, you actually put the heel, you step forward a little bit, put the heel down flat, and then you just bend the knee all the way, and very, very gently take knee bending to the end range, and then you just stay there.
Okay.
Very, very gently. Okay?
Great.
You understand?
Very much.
Good.
Thank you.
So as a professional dancer, I think this is going to serve you well.
I agree so.
Thank you very much.
Thank